You know those times when you need to see the doctor, but you just can't get to the doctor? So where do you go?
Ladies and gentlemen, here we are again, Hudson County View, live and uncut. I'm your favorite host, where what you see is what you get, and what you don't is better yet, John Arhitis. Of course, not much to talk about this week other than this coronavirus pandemic that is sweeping the entire globe, really. But obviously, we're going to give you as much local perspective as you can so that you can be prepared, that you can be safe, and you know what to expect in the coming days, weeks, and perhaps, if it comes down to it, months. So, first of all, I think the most noteworthy thing is the state officials over in Trenton, including Governor Phil Murphy, including Health Commissioner Judy Persicelli, have been doing a press conference daily this entire week, and I'm sure that's going to continue for the many weeks ahead. But importantly, the governor said just a couple hours ago that there have been 742 confirmed cases of COVID-19 in New Jersey, and there have been 9 confirmed deaths. And on top of that, we have 55 of those patients right here in Hudson County. So as you guys can see, the numbers are going up rapidly as testing becomes more widely available, as people are more cognizant of their symptoms, given that they're home, that they don't have to go into the office. This is a trend that's probably going to continue for, I would say, at least a couple of weeks. But, certainly we want to support all that with data, as we always do. So we're going to do that later on. When we talk about each and every municipality that we can, we want to give you the numbers for the town, the city that you live in, and we also want to tell you what some of our federal legislators are doing, as well as some of our locals, to try to alleviate the pressures, the anxieties, and the realities dealing with the coronavirus. So all that and much more when we come right back.
You know those times when you need to see the doctor, but you just can't get to the doctor? So where do you go? Go to the App Store, download the Telemed app from RWJ Barnabas Health, and you see the doctor right away. From any mobile device, whenever you want, wherever you are.
Quality care, no appointment necessary. The doctor is online when you download the Telemed app.
Don't you feel better already?
RWJ Barnabas Health. Let's be healthy together.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Visit us on the web at barnabashealth.org.
Hudson County View, live and uncut, and we're also going to be joined, as we were last week, with Hudson Media Group owner Pat O'Melia. But before we get some words with Pat, we wanted to give you, again, just some more data about this whole coronavirus situation over in Hudson. So first of all, notable that Hudson County View was the first to report that the first death in Hudson County was a woman in her 80s. That came from the New Jersey Department of Health late last night, maybe around 8:30, 9 o'clock or so. So I guess not too late, but certainly well past standard business hours. They would not discuss the case any further. They said due to the high volume of cases, which at the time was over 400, they said they wouldn't be able to provide any further details or information. So unfortunately at this time I can't confirm to you which municipality this woman lived in, but we are working on obtaining that information in every way that we possibly can. And in the event that we are able to get the confirmation, just like always, we will put it out there publicly. And in the meantime, though, I guess all we can really say or do is just offer our condolences to her friends and her family during this difficult time. So with that, just something that I think everybody wants to know, if you don't know already, is a brief rundown of what some of the numbers look like throughout the county of Hudson. So now, as I mentioned just a few moments ago, there's now over 700 cases throughout the state, 55 in Hudson. So I don't think that press conference ended probably around 1 o'clock, so I don't think most municipal officials in their defense were able to update since then. But the numbers as of, let's say, about 9 a.m. this morning, there were 30 cases that were confirmed. You have 15 in Jersey City, 7 in Hoboken, 2 in West New York, 2 in North Bergen, 3 in Kearney, and 1 in Bayonne. So just, again, as those numbers come in, we're definitely going to give them out as soon as humanly possible, and that's not a trend that is going to change as this whole situation continues to develop. So on the local level, again, going city by city, everybody is well aware that most non-essential businesses are closed. Certainly restaurants have been operating on delivery and takeout only for several days now across the state. Hoboken, of course, was the first to institute that policy, and Governor Phil Murphy and others before him have followed suit. But, again, this is the trend throughout New Jersey. And on top of that, it's of note that Hoboken was the first on the East Coast to declare that they are going to have a self-isolation policy, similar to a quarantine in place implemented in San Francisco, of course, on the West Coast. Now, a lot of people have asked me, well, what is this? Is this basically house arrest, or how does this work? And the good news for Hoboken, Hudson County, and beyond is no, it's not house arrest at all. There's still room to travel for doctor's appointments, of course, medical emergencies, helping a sick family member, as well as grocery shopping, and any other appointments that were deemed essential. But I mean, probably few exceptions on that end. But there are still a number of stores and businesses open. At least that was until Governor Phil Murphy said today, starting 8 o'clock, barbershops, hair salons, spas, nail and eyelash parlors, tattoo parlors are all going to be closed as of 8 p.m. tonight throughout the state. So we're getting closer and closer to that time where it's going to be just food stores and healthcare facilities that are going to be open. We're not quite there yet, but it doesn't look like it's going to extend far beyond this weekend, if that. So certainly something to be mindful of, this quarantine in place or the self-isolation, whatever you want to call it. They both seem pretty similar to me, but these two policies, or one of these two policies, I should say, is going to eventually be part of a statewide state of emergency. So something that I think most people are already thinking about, but if you're not, it's something you certainly want to put on your radar. So with that, we also want to mention that there is now a pre-screening tent at Christ Hospital. There was that's of course in Jersey City. There was a press conference today at noon. My colleague Corey McDonald was able to attend as we prep for the show. And basically the whole point of this tent is for people that feel that they are suffering from coronavirus symptoms can, just get a quick check and a quick look with physicians before they go into the emergency room and potentially infect other people. Obviously, healthcare professionals getting sick is a problem throughout the globe, and limiting their contact to people that have been exposed to the virus is obviously going to be crucial as more patients come in, as more beds are necessary, so on and so forth. So certainly that's a report you guys should watch out for this afternoon, shortly after this program concludes. I know Corey's working on it now, so that'll be available again shortly after this program is over. So with that, I'm going to take a quick breath, and we'll be back with Pat O'Melia. Just give me a second.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Visit us on the web at barnabashealth.org. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hudson County View live and uncut, and once again we're joined with Hudson Media Group owner Pat O'Melia. Pat, always nice to see you. Thanks for having me, and good to have you.
Cutting that one close.
Yeah.
Yeah, well, it's good I'm in the studio. I'm an instant guest.
All right.
Where are we going?
All right, so Pat, obviously the numbers are growing exponentially, and local officials, statewide, federal officials, as I mentioned at the top of the program, all trying to take some cumulative action. Something that you may not have seen, it just went on the website probably about 1:30, and Senator Bob Menendez has introduced a small business relief bill. That's not the exact name, but basically, what this legislation would do, if approved, it would allow small business owners to declare a situation with the coronavirus an emergency, and they could apply with interest-free loans up to $2 million. So this would obviously be extremely helpful in communities like Jersey City and Hoboken and beyond.
Well, small business is getting crushed in this. And, what are we left down? Supermarkets, pharmacies?
Supermarkets, pharmacies, gas stations, and of course our healthcare providers.
I've been doing an update at noontime, Coronis, and I'm doing the most numbers that we can come up with, cases. I'm not a doom and gloom guy. I think we're way overreacting. And we're testing. They're opening testing sites, actually swab sites. They're not testing. They'll do the swab, then they send the samples out for testing. As we do more testing, the mortality rate's going to come down. And maybe we sit back and say, this isn't as bad as we thought it was going to be. Because right now we're looking at nationwide 147 deaths. As of noon, it was 9,214 cases. Keep in mind, that's in the country. We got
United
a population
States.
of 350 million plus. This is fractions. We went through the swine flu back in 2009. We didn't go through all this, and 4,000 Americans died. 22 million were affected. We didn't take these precautions.
Well, it sounds to me like the healthcare professionals at the federal level are concerned because this disease can be transmitted so easily via contact or exposure.
It hangs in the air for about 3 hours. It'll live for 72 hours on your credit card. So when you're fueling up and you give that guy their credit card and you put it back in your wallet, you got 72 hours that the virus could be on there. If you are relatively healthy, especially if you're a younger person, you're going to walk through this. You have underlying medical conditions, you have a heart issue, diabetes, that sort of thing. You got to be really careful. But the steps we're taking where we are putting businesses out. Now, help is going to come. Like I said earlier today, in 3-4 weeks, there'll be help from the state, there'll be help from the feds. A lot of these small businesses won't be here in 3 or 4 weeks. Now, Governor Cuomo just waived mortgage payments for 90 days. So there are steps being taken. But when we survive this, and we will, maybe in 2 or 3 weeks, there may not be any jobs for these people to come back to.
Yeah, understood. I mean, look, the small business loan that I just mentioned, assuming that passes, certainly helpful. We also know that the small business associations across the country are working to try to come up with something, and I'm sure they will. And I know President Trump has signed at least a couple bills related to coronavirus relief, for lack of a better term. So, and we've also all seen on social media that there's the talk in both houses about sending a check as much as $1,000 per month to every resident.
I mean, coming in April and another one in May.
So yeah, so we'll see if that actually pans out. Obviously, it's not official, but the discussion, I think, is encouraging for people that have already been laid off or may end up having to, shutter their doors due to this unprecedented situation.
I think we overreacted. One good thing I think that is going to happen in the very near future, we have a patchwork of guidelines right now. Hoboken, they're isolating. Mayor Fuller passed his guidelines where he closed daycare centers. Governor Murphy wants the daycare centers open. I can see where the state is going to issue the guidelines. Say, listen, the municipalities, take a back seat. We're going to show you, what is going to be open, what's going to be closed. But the more we close these small businesses, they may not be able to last 2-3 weeks. And that's the fact of being a small business. They may not be able to last that long.
So you
So
think
all the help in the world, if you closed your doors, you're unemployed. And so are your people. And our unemployment, it's got to be in the 20s right now. It's almost to the level where it was in 1929. Soup lines are not that far away.
you think it's that bad?
It could get that bad real fast.
So what do you think about these self-isolation or the quarantine-in-place policies? Do you think that these are something that is a necessity for New Jersey at some point?
No, de Blasio was talking about it in New York City, and Cuomo said, I'll make that call, not you. I don't think we're at that point yet. We got to see more testing and more mortality. Of these 9,214 cases, 99%, 9,150 were mild. There was 1% that was serious. And right now, people are recovering. As of noon, there was 108 people who have recovered. And, you know, in Wuhan, China, for the first time, there have been no new cases reported. So we talk about flattening that curve. I think in Wuhan, in China, they have flattened it now. You know, and we're not going to be as bad as they are. We're not going to be as bad as Italy. We are pretty much proactive on this, especially the last 2-3 weeks. But it's unfortunately, it did take us 2 or 3 weeks to respond to this. But we have better medical, we have better hospitals. You really can't compare us with China. So I think we'll weather this far better. Just I don't know when we weather it, if there's going to be any jobs left.
So, you know, obviously when this is going to end, who knows? It's anybody's guess for now. But Governor Murphy's preparing for the worst. I'm sure you're aware, and many watching, I'm sure you're all aware that the governor sent a letter to President Trump this week, and he's urging him to allow the National Guard and the U.S. Army Corps of Engineers to come to New Jersey in order to help set up basically remote hospitalization locations.
Mass camps.
Yeah,
like
essentially.
The old TV show.
Right. So, you know, do you? A lot of people think where you're coming from that this is an overreaction, but a lot of people think it's a necessary precaution. And now a second letter came out with a delegation, including Senator Menendez, Senator Booker, Congressman Series, and all the other congressional reps throughout the state. Even Chris Smith down south, who is a Republican, all jumped in and said, you know, we basically second this call to action. So what do you think about that situation?
We need to prepare and do everything we can today if I'm wrong. Now, I'm not the fearmonger, but I could be wrong. So, yes, these guys should take every step. My question is, I think we're taking too many steps too quickly. The government should be ready, but I don't think closing businesses is the answer right now. If, you know, in 2 weeks, if things, you know, prove to be worse, then it was the right call. But right now, I don't, in my opinion, I don't think it's the right call. I think a lot of business is going to be lost, a lot of jobs are going to be lost. But, you know, props to President Trump, and both the Dems and the Republicans are working both sides of the aisle. Trenton is working on this. There's help coming, but that help is 3-4 weeks away, which doesn't sound like a long time unless you're in business and you got to do payrolls.
Sure, you got to
Now,
do payroll.
Cuomo just put a density reduction in New York where he wants to cut 50% of the workforce. He doesn't want, you know, 100% of the workforce in the warehouse or in the office or wherever at one time. So there's more layoffs coming.
So interesting on the Hoboken self-isolation order, something that I think a lot of people might have missed. I mean, it was a pretty extensive order, and there's
recommendation according to Governor Murphy. It was a recommendation because Tedesco, he had to rescind his executive orders because Murphy told him, said, "Man, I'll call those shots."
Correct. I mean, I believe the governor said quite clearly, at least a handful of times in the past few days, that, you know, he doesn't approve of any self-quarantine orders at this time. Which is probably why it was called self-isolation, but nevertheless, the Hoboken population now is apparently limited to public gatherings of just 5 people or less. I mean, what do you think of that?
I think we're overstepping. I suppose it doesn't hurt to take all the cautionary measures as we can, but what happens in 2-3 weeks and we survive all this? Those businesses are gone. There's an economy. You know, we'll survive the disease, but the cure may be what kills us. Things have been going well for the last 3 years. This economy is cratering right now. Now we're talking about another stimulus. You know how well that worked the last time. Mm-hmm. We need to get people back to work. And one of the good things about testing, it'll show the mortality rate, it will drop dramatically. And then maybe we sit back and say, well, this isn't the scary boogeyman we thought it was. This isn't Ebola virus here. We will survive this. If you're healthy, you're going to walk through it. Now, like I said, in 9,100 of these cases nationwide, 99% are mild. And this is from the CDC.
Right. Now, Pat, I noted, I just happened to see here that you have some of the locations where some of our locals could go for testing if they think they have symptoms. Probably a good time to mention that as well.
They're calling it testing centers. Really, it's a swabbing center. What they're going to do, they swab your cheek and your nose. There's going to be one open probably by the end of the week at the PNC Arts Center on the Parkway. Bergen County Community College, I think that opens by the end of the week. Hudson Regional out in Secaucus is open. And there's Riverside Medical Group, also in Seacork, is on 10th Street, 714 10th. That's open. But you need a referral from the doctor. You just can't roll up there and say, I'd like to get tested. You need a referral or prescription.
Right. I mean, Mayor Fulop, you saw his post yesterday, one of his many coronavirus updates you saw. He said, you know, we're really urging people, this is before the tent was set up at Christ, he said, we're really urging people to basically, you know, proceed with, you know, the utmost caution, of course, but to also let cooler heads prevail. And what I mean by that is he said, don't just basically run into the emergency center with a panic. Make sure you consult your physician first. And then if you do have the symptoms and he does think that this is an issue, then you would head to the hospital.
Here's the symptom: runny nose, pretty common. And what the coronavirus is, it's a cold. Sore throat, if you're coughing, you have a fever, fever's really the deciding factor. Difficulty breathing, and loss of appetite. Now, my wife every morning comes up with this electric thermometer and puts it against my head, 98.6. I didn't lose my appetite. And another interesting thing, there's not a lot of data yet, but if you have type O blood, it looks like you will have a mild case of coronavirus. If you got type A, it could be serious. There's not a lot of data on it, but that's coming out now. Now, Hudson County, what did you say we had, 50?
55.
At noontime, it was 34. And Ocean County, 8. Bergen County, 114. The further you get away from New York City, I don't know, we have that map handy from today on the live stream. Let me just take a look at this map. It showed the concentration of all the coronaviruses. New York, New Jersey, big red block, Washington, and Northern California. From there on, it's kind of sporadic. So it's going cross country from the east and the west coast. Why? You know, a heavy concentration in New York City and California and Washington. You know, somebody who can read these maps can figure out why it's so prevalent there and not in Utah or I think Nevada. There's a map there. You see it on the monitor, hopefully we're in full screen. Yeah, you look at the heavy concentrations, you know, it's really in 3 or 4 places, that's it. You know, what's going on in the middle country? So I'll assume it's people traveling for business, work, but I'd almost take a guess and say it's occurring from New York. People are in New York stopping by you know, from Europe, then going from New York to California or Washington. But somewhere has got to be where this all starts. And when you look at that map, if you got some scientists that can figure that out, he can probably figure out why it's in heavy concentration in those 3 locations.
Yeah, I mean, obviously that's certainly something people are going to want to know for the many days and weeks to come. Now, Pat.
Well, this is so fluid. When
Right.
I'm preparing to do the update at noon,
Yes.
I mean, at the last minute, I'm scratching, you know, this information just came in, this came out. You're talking, the Navy is sending the Comfort to New York Harbor.
Yeah.
Now, it's not going to do corona cases. It's going to take regular medical
Yeah.
and giving room to the hospitals to do corona. But as it stands now, I spoke to Mike Perlisky, the CEO of Jersey City Medical Center. They're ready for anything that comes. There's bed space. One of the problems the hospitals are having now, there's no elective surgery. So they're not doing a lot of surgery outside of trauma and the testing. So there's the hospitals, same thing with Palisades, same thing with Hudson Regional. There's beds available, just that there really isn't a need.
So while we're talking local again, let's talk about almost every municipality in Hudson has declared a state of emergency. And we're seeing, in addition to Hoboken, most North Hudson municipalities have now adopted a curfew. Actually, I think everyone except North Bergen, if I'm not mistaken. What do you think about this curfew? Do you think this is something that is going to be effective and necessary?
As the weather changes, it's going to be different. Because also, you got all these kids at home. You can't keep the kids locked up in the house all day. Eventually, as the weather gets warmer this weekend, it's going to be in the 70s, I think Friday or Saturday.
All right.
We'll see how the quarantine works, or the curfew, whatever you want to call it. Hoboken, you know, they're not really abiding by this as it is. Yeah, you see the people on the streets. We're not, most people like me, we're not fear mongers. You know, they want to go out, they want to have a donut. I don't know, why are we closing the bakeries, by the way? They can only do takeout. Not that I'm a big bakery guy, I just noticed that today. I said, you know, can't you go in to get a donut? I got to wait at the door to get a donut? Come on.
Yeah, well, all restaurants, food establishments is pickup, delivery only.
Your favorite restaurant's probably not going to come back. You take Central Avenue, it's difficult for Central Avenue to survive as it is. The only person that makes money there is the guy that does the awnings. Because businesses have, it's a tough avenue. And all those new restaurants that opened in the last couple of months, they probably won't be there when this is all said and done. I'd like to see the city. Now, I sent some questions to Mayor Fulop. He's very busy.
Of course.
I was curious if he was going to suspend the school tax, but with a 40% increase coming up, yeah, maybe you should suspend the school tax for now.
Actually, let me jump off that point, Pat. So, interestingly, obviously, there's still governments to be run around here, even in the midst of a pandemic, right? So the Jersey City Board of Ed, one of several that had meetings last night. Hoboken Council did a remote meeting by Zoom. The Bayonne City Council, West New York Board of Commissioners still met in person. But the point is, like you said, there's still a lot of pressing issues going on in the county, like this school deficit. I mean, this $736 million budget with a 46% tax increase. I don't know if you saw our story just before we went on, but Mayor Fulop said this would completely decimate the municipal budget. He didn't say the decimate, but he said it would have a huge impact. Paraphrasing, of course, and he said they basically have to start over. So, you know, what do you think?
Well, when you came in, I said, I guess the referendum's on. You know, 47% is incredible. I don't even know what steps the Board of Education has taken now just with the coronavirus. Did they lay off any teachers?
To date, they haven't announced any layoffs.
Have there been any layoffs? No. And same thing with the city and the county. There have been no layoff there either. You know, I want to know if Mayor Fulop is going to give some sort of a break on property taxes for these small businesses, because the city can weather this a lot better than some small guy that has a corner store or a barber shop or a bakery.
Yeah.
You know, we got to do all we can to help the small business.
Yeah,
And
obviously
40% increase to a rent or a mortgage, that's cratering the property taxes. Don't worry about the layoffs then, because we'll all be gone.
Well, that special, it's just the first reading, so there is time for adjustments, but there is a special meeting at 5 o'clock today, scheduled for anyway. Let's see if it happens, but it's currently scheduled for 5 o'clock
Is
today.
it on live stream? Is this online?
This will be on the Jersey City School District website.
is
I have
Ma-
a feeling you have a few comments.
Yeah, is Mayor Fulop going to be signing in? That should be pretty interesting.
I
And
can't-
his buddy Michael Youn, the two of them going to stand there side by side?
I don't know.
I think he signaled us to go to commercial. Do we want to go to commercial? End the show. Oh, end the show. Oh, we got an hour. We got a minute 50.
We're on limited time, Pat. But
No, that was quick.
But yeah, so so that between the multi-million-dollar deficit at Hoboken and just day-to-day business, like what do you do if you're a Hudson County freeholder or a councilman or a mayor? Like how does this impact?
Well, you got elections coming up pretty soon.
Yeah.
You know, and the thing is, most people don't realize they get the tax bill. You know, they'll blame Mayor Fulop for the 47%. When Glenn Cunningham was the mayor, at one point he was going to knock the county out. He didn't want to collect their taxes anymore because every year it would go up and Glenn would do all he could. You know, that might be a case someday. Fulop may say, go collect your own taxes. I don't want to be blamed for this. But 47%, if you're a council person, you're going to get blamed, even though you have no control right now. They're going to blame a council person. They're going to blame the mayor. We can't go up 47% in one jump. Actually, you couldn't do 47% over 5 years. Yeah, it's pretty expensive now, right, coming off the revale, no less.
And that's considering $86 million coming from the city payroll tax.
Is it 86 now? I thought it was 40. Oh, that was somebody misread the numbers.
It was, it depends who you ask. I don't know what happened, but yes, it initially was listed as 40 for 2020, and it went from 40 all the way to 86. Honestly, I don't know exactly how that
Hoboken's
happened.
deficit doesn't look too bad now, does it? What is it, 7 or 14 million? What are they up to?
Let's call it 10 and a half. We'll meet in the middle, but yeah, I'm not exactly sure. We haven't got that announcement yet. The budget was supposed to be announced in Hoboken, the initial budget, on April 1, but now in the midst of all this, who knows what's going to happen. Pat, look, I've had a great time with you, but it looks like we're already, unfortunately, out of time.
Hopefully we get this kind of views we had last week. That was like record setting.
Let's
All
hope
right,
so.
you're going to close?
I will close.
Close it up.
Ladies and gentlemen, thanks so much. You know, we know this is a very trying time for all of our readers, viewers, friends, and family, so just thank you for making us a priority, and everybody stay safe.
Stay healthy.